think this is an area which really demands working across at least medical disciplines. So actually for years, we had support group members who would say things like, oh, my ophthalmologist doesn't seem to have heard about posterior cortical atrophy. Don't the neurologists and ophthalmologists talk to each other? And largely prompted by comments such as this, over the past 10 years now, myself and colleagues at University College London, we're working closely with organizations like Moorfields Eye Hospital and also the College of Optometrists to put out training on really being able to recognize some early symptoms of posterior cortical atrophy, what we might call, say, red flags. And in particular, which of these symptoms or signs are hard to perhaps account for by an eye condition. And in a sense, this recurring experience of a lot of people with posterior cortical atrophy, very tragically, of seeing a number of eye health professionals over a period of years often, where they might spend hundreds of pounds on different glasses. Some people might even undergo cataract surgery, and it's not addressing the visual symptoms. Already, to a sense, we do know that the symptoms they're experiencing can't be accounted for by an eyesight problem. It's this brain sight difficulty, a problem of communications between the eyes and the very back of the brain. But there's some things that neuro-ophthalmologists have recommended as paying particular attention to in the assessment. Number one is the unexplained tendency to miss items in a visual acuity chart. Now, for people with PCA, their visual acuity can be relatively, actually very well preserved, even at intermediate stages of the disease course. Issues people can have is moving, say, between one item to another in the charts. They might get lost going from left to right or from the top to the bottom of the chart. Other people experience this difficulty, which is referred to as excessive visual crowding, essentially referring to a particular difficulty perceiving objects presented amongst clutter relative to objects presented in isolation. They might have more difficulty with items in the chart towards the center chart rather than, say, items on the perimeter. And the other very counterintuitive problem that some people with PCA can experience is sometimes this particular difficulty perceiving very large relative to small objects. So this is something whereby, say, for instance, someone might have particular difficulty reading the headlines of a newspaper that's right in front of them. They might have less difficulty reading smaller text within a column of the article itself. So for these reasons, you can adapt things like a standard visual acuity chart. So it's one item at a time. So it might be more appropriate in terms of assessing visual acuity for people with PCA. The other things, neuro-ophthalmologists, as well as us in this recent Lancet Neurology Review, have recommended paying attention to are things like early spatial disorientation, people perhaps feeling like they're that less confident getting around environments, sometimes even what should be quite familiar environments. And also other difficulties like unexplained problems with color perception tests, like the Ishihara test, where essentially you have a series of numbers presented amongst colored dots. Actually, for a lot of people with PCA, they might not have a color perception problem. The issue they have is really forming this coherent percept of the number when you have this fragmented object. And this particular difficulty, either whether you want to call it perceiving the whole of things, which some people might in shorthand refer to as simultanagnosia, or say this difficulty with perceiving visually degraded objects, which some people might refer to as an apperceptive agnosia, but where it might manifest is, for example, particular problems with me perceiving this mug from an unusual angle, say from a bird's eye view relative to this canonical view, or say me perceiving, say, my keys that are left on a busy tabletop surrounded by other objects, other clutter. Although undoubtedly other visual symptoms like what I mentioned about excessive visual crowding at least are a contributing factor.